Hi, I'm Dr. Ahmed Al-Masri. I'm consultant radiologist and Chief Medical Director of Tadawe Healthcare Group. Today we'll be having the first Tadawe podcast. We'll be interviewing Dr. Papp. He's head and consultant surgeon, head of surgery department in the whole group. He's one of the very well reputable doctor in general surgery and bariatric surgeries. So, good morning, Dr. Papp. How are you today?
Good morning, Dr. Ahmed. I'm fine. Good morning to everyone.
Can we talk today about the new advances of general surgical procedures that makes the patient's outcomes and post-operative time make it more beneficial for the patient?
In a modern hospital, actually, the general surgical department is a key department because it's serving the other departments in the hospital. So the general surgical department should be a very, very, modern and safe and stable, department. So the most important things in the patient's care is just selecting the right patients for the right procedures, minimal invasivity, which is very important, and the enhanced recovery, what we can talk about a little bit further. These are all it's a group of maneuvers and procedures what we do for the patients for the better outcome. So nothing better than the satisfied patients by the end of the day.
That's right. As we all know that there are new procedures happening every day, every year in the surgical department. So how the bariatric surgery and laparoscopic surgery affects the patient's outcomes? In the sense of the post-operative and discharging the patient early or in a reasonable time after the operations.
The minimal invasive surgical procedure means the gold standard of this is the laparoscopy. Laparoscopy means, or the synonym of this, like a keyhole surgery, we create just only small cuts, 1 centimeter or 5 millimeter cuts, which means the non-invasibility, and we perform the surgery in the same length, occasionally quicker than an open surgery. And of course, it will impact the hospital stay. It's much shorter. Occasionally, after colorectal surgeries or resection for colorectal cancers or any other emergency surgeries, the patient can be discharged within 1 day or maximum 1 night they stay here in the hospital. Hernias, gallbladders, and bariatric surgery, as you asked about that. So it's all under the keyhole surgery. And actually, it guarantees that the patient's outcome and much less pain after the surgery. The benefits are numerous. So, it's a new era. This is the 21st century and with the technology.
Yes. So how can you deliver a message to the patients regarding how safe is the laparoscopic surgeries rather than open ones? Sometimes we need to do open ones, as we all know. But how safe is the laparoscopic surgery being more beneficial for the patients? How can we deliver this message to the patients?
The benefits are there, definitely. It's 100% safe, like an open surgery is safe. We can't compare the two ways from the safety prospect. But the shorter recovery, the shorter period of time what they need to spend at home on sick leave, for example, it's far, far better after a keyhole surgery. We treat here in the hospital emergency and planned or elective cases like hernias and hemorrhoids and other surgeries. So definitely we are keen to provide to our patients the less invasive and the most efficient part of the surgeries. And our outcome is really good, to be honest, because this is the feedback from the patients. And if they are satisfied, then definitely they will feel the privilege to give us good compliments and ratings on the Google. We get the feedback from our patients. And as we treat from the general surgical department, I can talk about around minimum 20 patients we see for surgeries, per day, occasionally more, and doing numerous, general surgical procedures. So we have a vast of experience of these feedbacks and the outcomes.
Yeah, can we just give a brief, message to the patient regarding the colorectal surgeries? how we can also make it more safer with your new techniques of laparoscopic surgery. Colorectal cancer, for example.
Colorectal surgery is a very hot topic. Unfortunately, the incidence rate of the colorectal cancers is increasing. This is due to the epigenetic problems, what we eat, how we don't do actually exercises, and we are overweight, and many other factors further to the genetic factors, but it's unfortunately increasing the numbers. Screening is this is crucial. So everyone needs to care of their health and at least visiting a GP if they have any symptoms, which is typical for any kind of colorectal problems. I'm talking about problems because not all of the colorectal symptoms are meaning immediately a colorectal cancer. So don't get scared. We should communicate to the patients that most of the majority of these problems are treatable, curable, along with the gastroenterologist. And general surgeon is doing surgery in 2 cases, or 3 actually. One is some benign lesion, like an inflammation in the bowel and diverticulitis. It's a kind of inflammation in the bowel. Colorectal cancer, definitely. Treating of the colorectal problems. And the third topic is also very, very important to mention is a joint case to the gynecologist for endometriosis, because most of these endometriosis cases affecting the colon. We try to perform all of our colorectal surgeries as keyhole. It's possible, and by 3-4 small cuts, we can perform the same procedures. Which was a couple of 10 years ago was a total laparotomy and opening up the whole abdomen,
the muscles and
everything, with the consequences of a later hernia, things. So no benefit from open. Definitely the open surgeries for safety. For a conversional, when we start the procedure as laparoscopic, but we can't handle from some point, then we need to open up, unfortunately, the abdomen. But let's say 90% of the colorectal cases can be managed under laparoscopy.
Great. So let's take this message to the population regarding the checkup of the colon with colonoscopy. It should be done with, there are criteria for that and guidelines. So we can diagnose earlier the cancer or even the polyps, the adenomatous polyps, which are mostly benign, but we have to remove them before turning into cancers in maybe a couple of years. So this is another message that we have to do a colonoscopy. We have to visit our physicians to do the colonoscopy to just early diagnose, and if possible, if found like a cancer, the surgery will be much better outcomes rather than leaving the patient with the complication. Thank you, Dr. Papp, for the valuable information.
Thank you for the opportunity, and anytime.